The milling sector has been designated essential service status curing the 21-day lockdown, which may be extended. SMMAZ urges its members to ensure that they protect their employees and customers by putting into place competent occupational health and safety procedures. While this information is specific to the milling environment, the general practices are applicable to many home and work environments. Each miller is encouraged to develop an infectious disease preparedness and response plan to combat COVID-19 spread. The need to decongest is the biggest motivation behind the government's decision to place the country on an initial 21-day lockdown. Countries which have recorded successes in the fight against COVID-19 have had to extend the number of lockdown days. Therefore, as SMMAZ, we need to embrace and prepare for the possibility of a lockdown extension in Zimbabwe. SMMAZ encourages members to sustain the measures and practices outlined here beyond the lockdown period. This is a vital lesson learned from the successes recorded in the fight against another virus, HIV and AIDS. Coronavirus and what you need to know. How does it spread? People can catch COVID-19 from others who have the virus through inhaling small droplets from infected people who cough or sneeze, or through touching contaminated surfaces and then touching one's nose, mouth, or eyes. Research has also found that COVID-19 can remain active on different mediums and surfaces in and around the site and workplace for a few hours or up to several days. How to prevent the spread. The following can be done to disrupt COVID-19's chain of transmission. Decongestion and reducing contact with both individuals and surfaces. Sanitization and disinfection of hands and surfaces. Wash your hands well and often to avoid contamination. Cover your mouth and nose with a tissue or sleeve when coughing or when sneezing, and discard used tissue. Avoid touching eyes, nose, or mouth with unwashed hands. Clean and disinfect frequently touched objects and surfaces. Stop shaking hands or hugging when greeting people. Distance yourself at least 2 meters away from other people, especially those who might be unwell. All these measures should be practiced both at work and at home. The following are steps of hand hygiene. Symptoms of COVID-19 are cough, fever, tiredness, and difficulty breathing in severe cases. The following are steps you can take in implementing your OHS guidelines as part of your infectious disease preparedness and response plan. Declare your site, factory, and offices a quarantine area. Anyone and everyone, including your staff, visitors, and customers, can only access the site once they have been screened by doing temperature checks via thermal scanners or digital thermometers and sanitized. Make a visitor's logbook available at entry points. While SMMAZ discourages visiting by customers and members and rather supports the use of any other forms of doing business, such as through mobile and electronic means. In the case that people have to physically come in, a visitor's logbook, in addition to a staff register, should be maintained at every site. Provide prudent personal protective equipment for all your employees, which include triple-layer masks, heavy-duty gloves, and disposable rubber boots. Provide as many clearly labeled sanitization stations and encourage members to use them as frequently as their work schedules permit. Pay attention to cleaning and disinfection of offices and public places such as waiting rooms and toilets. Where possible, set up temporary outdoor or open air workplaces and discourage the use of aircons as they speed up the circulation and spread of air in the event of contamination. For more information on these guidelines, a SMMAZ COVID-19 OHS guideline is available upon request. You can email us at covid19@smmaz.org. You can also WhatsApp us using the number on the screen and we'll be sure to get back to you.